Sleep is a fundamental pillar of human health, yet millions worldwide struggle with sleep disorders that disrupt their rest, daily functioning, and long-term well-being. In this video, we will explore common sleep disorders, focusing on insomnia and sleep apnea, along with other notable conditions, their causes, symptoms, diagnosis, and treatment options. By understanding these disorders, individuals can seek timely intervention and improve their quality of life. Sleep disorders are conditions that impair the ability to fall asleep, stay asleep, or achieve restorative sleep, often leading to daytime fatigue, mood disturbances, and health complications. They range from difficulties initiating sleep to abnormal behaviors during sleep. The most prevalent disorders include insomnia, sleep apnea, restless leg syndrome, RLS, narcolepsy, and parasomnias, and insomnia, the most common sleep disorder, involves difficulty falling asleep, staying asleep, or waking too early, despite adequate opportunity for rest. It affects approximately 10 to 30% of adults, with higher rates in women, older adults, and those with stress or medical conditions. Psychological factors. Stress, anxiety, and depression often fuel insomnia, as racing thoughts prevent relaxation. Lifestyle habits. Irregular sleep schedules, excessive screen time, caffeine, alcohol, or nicotine use can interfere. Medical conditions. Chronic pain, asthma, or hormonal imbalances, e.g. hyperthyroidism, may disrupt sleep. Environmental factors. Noise, light, or an uncomfortable bed can hinder rest. Trouble falling asleep, onset insomnia, frequent awakenings or inability to return to sleep, maintenance insomnia, early morning waking with inability to resume sleep, daytime fatigue, irritability, poor concentration, or impaired performance. Doctors diagnose insomnia based on sleep history, a detailed account of sleep patterns, duration, and habits, often via a sleep diary. Questionnaires. Tools like the Pittsburgh Sleep Quality Index assess sleep quality. Actigraphy. A wrist device tracks sleep-wake cycles over days or weeks. Chronic insomnia is defined as symptoms occurring at least 3 nights per week for 3 months or more, per the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Cognitive Behavioral Therapy for Insomnia, CBTI. The gold standard, CBTI, addresses thoughts and behaviors, teaching relaxation techniques, sleep restriction, and stimulus control, e.g. using the bed only for sleep. Lifestyle changes. Maintain a consistent sleep schedule, limit caffeine after noon, and create a dark, quiet, cool bedroom. Medications. Short-term use of sleep aids, e.g. Zolpidem, Esopiclone, may help, but risks include dependency and side effects like drowsiness. Address underlying issues, treat anxiety, depression, or pain to improve sleep. Sleep apnea is a serious disorder characterized by repeated pauses in breathing during sleep, lasting 10 seconds or more. It affects roughly 5 to 10% of adults, though many remain undiagnosed. The 2 main types are obstructive sleep apnea, OSA, and central sleep apnea, CSA. Obstructive sleep apnea, OSA, the most common form caused by airway blockage from relaxed throat muscles, excess weight, or anatomical factors. Central sleep apnea, CSA, less common, resulting from the brain failing to signal breathing muscles, often linked to heart failure or stroke. OSA, obesity, large neck circumference, 17 inches in men, 16 in women, smoking, alcohol, and aging. CSA, heart conditions, neurological disorders, or opioid use. Shared risks, family history, male gender, and age over 40 increase likelihood. Loud snoring, especially in OSA, gasping or choking during sleep, excessive daytime sleepiness, morning headaches, dry mouth or sore throat, memory issues, irritability or reduced libido. Polysomnography, an overnight sleep study in a lab or at home, measures breathing, oxygen levels, heart rate, and brain waves. Home sleep apnea testing, HSAT, a portable device monitors breathing and oxygen for milder cases. Doctors use the apnea-hypopnea index, AHI, to gauge severity. Mild, 5-15 events hour, moderate, 15 to 30, severe, 30. Continuous positive airway pressure, CPAP. A machine delivers air through a mask to keep airways open. It's highly effective for OSA. Lifestyle changes. Weight loss, avoiding alcohol, and sleeping on the side reduce symptoms. Oral appliances. Dental devices reposition the jaw or tongue to open the airway. Surgery. Options like uvulopalato-pharyngoplasty, UPPPP, or implants address severe cases or CPAP intolerance. CSA treatment focuses on underlying conditions, e.g. the heart failure, and may include adaptive servoventilation, ASV. Complications. Untreated sleep apnea raises risks of hypertension, heart disease, stroke, diabetes, and accidents due to drowsiness. Overview. A neurological condition causing an irresistible urge to move the legs, often at night, affecting 5 to 10% of adults. Symptoms: crawling, tingling, or aching sensations relieved by movement, worsens during rest. Causes: iron deficiency, pregnancy, kidney disease, or genetics. Treatment: iron supplements, medications, e.g. dopamine agonists like pramipexole, and avoiding triggers like caffeine. Overview. A chronic disorder marked by excessive daytime sleepiness and sudden sleep attacks, affecting 1 in 2,000 people. Symptoms: cataplexy, sudden muscle weakness, sleep paralysis, hallucinations, and fragmented night sleep. Causes: loss of hypocretin-producing brain cells, possibly autoimmune or genetic. Treatment: stimulants, e.g. modafinil, sodium oxybate for cataplexy, and scheduled naps. Overview. Abnormal behaviors during sleep, such as sleepwalking, night terrors, or REM sleep behavior disorder, acting out dreams. Causes: stress, sleep deprivation, or neurological issues. Treatment: safety measures, e.g. locking doors for sleepwalkers, stress management, and medications like clonazepam for severe cases. Untreated sleep disorders impair physical and mental health, increasing risks of cardiovascular disease and diabetes, depression, anxiety, and reduced quality of life, workplace errors, driving accidents, and strained relationships. Sleep hygiene. Stick to a regular bedtime, limit screens before bed, and keep the bedroom at 60-67 degrees, 16 to 19 degrees. Healthy habits. Exercise regularly, avoid late evenings, maintain a balanced diet, and manage stress through meditation or yoga. Seek help. Consult a doctor or sleep specialist if sleep issues persist beyond a few weeks. Sleep disorders like insomnia, sleep apnea, and others disrupt millions of lives, but effective treatments exist, from CBT-I for insomnia to CPAP for sleep apnea. Tailored interventions, combined with lifestyle changes, can restore restful sleep. If you suspect a sleep disorder, track your symptoms, consult a healthcare provider, and consider a sleep study. Prioritizing sleep is a vital step toward better health and vitality.